This is my answer. Hi everyone. So, who here has had a loved one die? So, as we know, this experience has an emotional toll on the entire family as well as our loved one themselves. So when you all went through your loved one's death, I'm sure someone told you to remember the happy times that you had with your loved one, right? Now, imagine if you couldn't remember those happy times. If the only memories you had of your loved one were those of the most recent, of your loved one in suffering for a long amount of time against their own will. So, that is why we need laws called death with dignity laws. These laws allow the patient to take control of their own life. This is called physician-assisted suicide, in which a physician will help a terminally ill patient administer their own suicide. Why we need these laws are that over the next few years, these chronic and debilitating diseases are going to increase among the population. CDC in 2018 states that as of now, 6 of every 10 people will develop a chronic and debilitating illness. That means potentially 2 of us in this room could develop one of these diseases. Furthermore, that these diseases could affect you, your loved ones, or many of your friends around you. So, what I hope for you all to gain out of this presentation is to understand what death with dignity laws are, why we need death with dignity laws, and I want you guys to be able to visualize a world in which we have death with dignity laws and understand why we need them, therefore. So, first of all, death with dignity, again, is physician-assisted suicide, in which a terminally ill patient with no chance of recovery is prescribed medication in which they can administer their own death. This includes disorders like terminal cancers, Alzheimer's and dementia, genetic diseases, and immunodeficiency disorders. My own experience is that with Alzheimer's, my Nana has Alzheimer's, and according to the Alzheimer's Association, it's the sixth most common cause of death. Furthermore, in the population, by 2025, it's going to increase by 14%. Now, this is just Alzheimer's. Now imagine a world in 2025 in which this is the case for all these chronic and debilitating diseases. So now my Nana, who is Alzheimer's, I've had to watch her over the last 5 years lose a sense of the person that she was. Today, she doesn't know who she is anymore. She doesn't know her family, and she doesn't know what is happening in the everyday life she is living. And that's why we need death with dignity, is that our loved ones do not deserve to die on terms in which they can't control. So physician-assisted suicide, again, is which the terminally ill patient can administer their own death. In a recent Gallup poll in 2017, 73% of Americans support physician-assisted suicide, but there are still no laws in place for physician-assisted suicide. A doctor, Charles Blank, in 2017 gave an interview of what it is like to be a doctor who administers or helps with physician-assisted suicide. He lives in Oregon and works in Oregon, which is the first state to allow death with dignity laws in 1997. So in the Journal of Oncology in 1998 did a study on the effects of the patients with death with dignity laws. So Charles Bark and this study found that it reduces the physical pain that the patient is experiencing in their end of life. It reduces the emotional traumas of the patient and the entire family, and the financial burden on the family. That way they're not paying for end-of-life care in a hospital for their loved one to ultimately die. So now, I need you all to imagine a world where we don't have death with dignity laws. And unfortunately, that is today. So we have Brittany Maynard, a woman 29 years old with a husband and aspiring for a family. But she was diagnosed with a terminal brain cancer. Her life has stopped. She lives in California and can't have death with dignity. So she picked up all her belongings, she took her husband, and she moved to Oregon, in which she can have death with dignity. She moved to Oregon and died with her husband by her side, but not with her entire family, not with her friends, not in the comfort of her own home around the things that she loved. She uprooted her entire life in order to take control of her own end-of-life process, and that's not fair. So now imagine Brittany, 29, still living in California with her husband, surrounded by her mother, her father, each of her loved ones, and in control of her life. How she dies, when she dies, where she dies, on her terms. That is the way we should all deserve to die, and that is what I'm sure you all would agree with. So, what we need to do then is contact our legislators. Our legislators will help us enact these death with dignity laws. When you email or call them, be sure to include that we need these laws because chronic and debilitating diseases are on the rise within the next decade, and that physician-assisted suicide provides a solution that gives the patient back the right to their own life. Remember why you are doing this when you email or call them. Remember that you or a loved one could be affected by one of these diseases, and if it were you affected by one of these diseases, ask yourself, how would you want to be remembered? Thank you. Now, questions.
Yes, so you said that it's a self-administered. How is it is it a shot you give yourself?
No. So yeah, it would be very difficult for someone in the end of their life process to give a shot or an injection to themselves. As long as they can physically take a pill, it's in the form of, it's a barbiturate, so it comes as a pill. So as long as they can take a pill, they can administer their own suicide drug.
So just to clarify, it just gets prescribed
yes.
to them,
so
and they just pick it up and take it.
It is a lengthy, not a lengthy process, but an extensive process in which the patient who is terminally ill has to be deemed terminally ill with a life expectancy less than 6 months by at least 2 doctors. Then both doctors must prescribe the barbiturate, and then the patient will then have the barbiturate and then can end their life whenever they deem it is their time. Any other questions?
So just to clarify, you said, so this is only for patients who are terminally ill, this isn't for like someone who's just extraordinarily old and just...
No, this is not for someone old,
okay.
Old and cranky and just wants to die. This is someone who cannot have control of their own life anymore. They lose quality of life, they are going to be in more pain at the end of their life than any person just going through the aging process.
I want your opinion. Do you think 6 months is too short?
I think 6 months is too short.
Okay.
That is personally, to see someone suffer for 6 months, so if someone is given a year to live, for example, they're going to be suffering for a great amount of time during that year.
Mm-hmm.
To see them suffer like that isn't fair to the patient, it's not fair to the family. 6 months is a long amount of time in the scheme of things, but it's a long amount of time to suffer. So in that sense, I don't think it's, with that restriction, I think it needs to be, these laws do need to be expanded, but I think the first step is getting them there in the first place. So, any other questions? Thank you all.